but we've also been watching the coronavirus case count here in the U.S. continue to climb. In California, the state actually set a daily record, topping New York as the largest amount of confirmed cases per state, while deaths in Texas reached a new high. Florida also reported total coronavirus deaths on Thursday that were the highest single-day increase that we've seen since the pandemic started. And over in Arizona, we've been tracking the way that a lot of the case counts have been impacting younger citizens of that state. And joining us now for the latest in what we're seeing play out in Arizona is Dr. Shad Marvasti, Director of Public Health Prevention and Health Promotion Curriculum and Associate Professor of Family, Community, and Preventative Medicine at the University of Arizona College of Medicine in Phoenix. And Dr. Shad, when we look at it, I just raised the point that we did see a large majority of these cases recently hit those younger than 44, mainly two populations, those younger than 20 and those younger than 44. And when you look at that, how might that actually lead to a delay in the death count or hospitalizations in Arizona when we think about how this is impacting different age groups differently?
Yeah, thanks, Zach, for the question. Yes, in fact, as you know, in our state in the last few weeks, over 50% of the new cases have been in the 20 to 44 range. And so that does impact, because this range of folks tends to be more healthy, not have chronic illnesses. And one of the things that they're finding out is that they're not invincible. They actually will get sick to the point of being hospitalized, but perhaps survive. And being hospitalized still takes up resources. Those valuable beds can be used for older adults and people with chronic illnesses who have a much more difficult time with the COVID-19 infection, as well as people don't think about heart disease and cancer and diabetes and all the other reasons to go into the emergency room in the hospital from a heart attack or stroke, right? When the beds aren't available, we can't take care of you for those emergent reasons as well.
And when we think about how it's impacting different age groups, I even have my friends in my age group here, millennials, who are starting to travel again, get back on airplanes and think about all this. But it's also at the forefront of the conversations right now being had over whether or not schools should come back. An interesting new poll there from the AP and NORC Center for Public Affairs saying that only about 1 in 10 Americans think daycare centers, preschools, or K through 12 schools should open in this fall without restrictions. What's your take maybe on what's being missed in the conversation right now about opening schools and the way that we don't seem to have a handle on this yet? And the question mark still, as you said, around younger people getting infected.
Well, I think the main issue here is that there's not a one-size-fits-all approach to schools. And so we really need to look at it by community, state by state, local spread. And that's kind of what the American Academy of Pediatrics released in their statement. And then we need to have benchmarks in place in terms of key criteria that you need to meet. Just like you look at numbers and financial benchmarks in terms of the health of our nation economically, the same thing needs to be done public health wise. We need to have those metrics in place and those guidelines. And I think some of the folks who've mentioned some numbers is if we have less than 5% positivity rate, if we have fair to good hospital and ICU capacity, I would say at least 20% or more. And so that shows that we have adequate testing and we have limited community spread. Then you know that you're able to safely reopen schools. But even with reopening, as you said, in terms of the numbers in places like California, which is actually Governor Newsom has done a great job with respect to all the public health measures and enforcing them for folks and even rolling back phases of reopening, they still have received the record for deaths right now in terms of where they're at. So it's not something that's going away. And even with reopening, it's going to look different. And I think what I would say to folks going back to university or school, or some of the folks in your generation are traveling, we still need to take all the precautions. It's not going to be normal as it was before. It's a new normal. And none of us live in a vacuum, whatever age we are. We interact with other people. And so you never know who's more susceptible and who's higher risk. And you could be asymptomatic and be fine, but then transmitting to others. So wearing masks, keeping distance, taking precautions, and building in those new precautions once we meet metrics to reopen schools and university are going to be critical.
Yeah, and especially as all the public health experts warn, the farther along we go, still flu season to worry about when we hit winter as well, making all this much more serious. But Dr. Shad Marvasti, appreciate you taking the time to chat.
Pleasure, Zack. Thank you.